Hi there, everyone, those who are watching. I'm all set up here. I've never used Facebook Live before, so if someone out there is watching, maybe just let me know on the comments if at least someone can hear me. That will be helpful. Okay, perfect. So I think if I'm seeing correctly, there's 4 people watching right now, so I might just wait like 2 to 3 more minutes, maybe 2, just to give anyone a minute or 2 to get on. Great, okay. All right. Well, anyway, I guess I'll go ahead and get started. It looks like it's about 3 minutes after 5, so happy to be here talking to whoever's here and hopefully answer some questions, shed some light on some information about Saba. To start things off, I guess my name's Trevor Dorey. I'm a third-year medical student, almost fourth-year medical student at Saba. I'm just near the tail end of my time on my third year, and I thought I'd come on. The admissions committee asked that I come speak a little bit and talk a bit about my experience, maybe answer some questions that they've gotten for whoever's here and interested, prospective students, maybe current students on the island who are curious about clinicals, maybe family members of people who are coming to Saba or planning to come to Saba, maybe that'll be helpful. So a bit of a background about me. Before I started on Saba, actually quite a while ago, I did a bachelor's degree at University of Calgary in biological sciences. My focus in that degree was mostly cellular and molecular biology. I also completed a bachelor's degree in psychology, mostly with a focus in neuroscience. My goal when I was doing that work was to eventually end up in medicine. But when I graduated from my undergraduate degree, an opportunity came along in the energy industry. And so I ended up working as an environmental scientist for about 6 years and did a master's degree actually in environmental science, but, somehow ended up back at Saba. Why that's important? I think that it's quite possible that people who are maybe thinking about going to Saba, they could be wondering, I'm in my mid-20s, I'm in my late 20s, I'm in my early 30s, is it too late for me to start studying medicine? I would have to give that an emphatic no. If you want to study medicine, then I think that, it's never really too late to start. And I'm happy that I made the career change to come here. Right. So how did that come about? I was actually being visited by a friend of mine who was a Saba student at the time. This is back in about 2014 or 15. He was actually in his break between the basic sciences portion of the program on the island and his clinical years, and he took a short visit out west to visit me, and we went on a little trip. And while we were doing that, we were talking about medicine and studying medicine, and he kind of asked me why I never really went back to it. And anyway, from that discussion is where I ended up thinking that I should really go for it, and I applied to Saba. And I actually only applied to Saba because the feedback that I got from my friend who was a Saba student at the time, and then based on my research that I did of some of the other Caribbean schools, I didn't really feel that I wanted to go anywhere else. I just wanted to go to Saba. So that's where I applied, and I got accepted, and I enrolled. So I have to say, once I enrolled, I had like an instant bit of anxiety because I realized I was going to a place I never heard of. Before talking with my friend about it, I didn't know, I knew generally on the map where it was, but I wasn't really so sure. And I didn't know what it looked like there. I didn't know how many people were there. And, when I was preparing to go, I had tons of questions that I called, again, my friend who was attending the school at the time. I called him and asked him everything you could imagine. How many pair of pants do I need to bring? What kind of gloves do I need for anatomy lab? How am I going to get water? All these things that I was worried about when before I went. And then I got there and I realized that it's actually all incredibly easy. There's grocery stores, there's hardware stores, there's hairdressers, there's restaurants, there's hotels, there's pools, it's all there. So that was, a big relief when I got there. I thought, I was kind of worried about nothing. So, and it was a great experience. Just a bit about, the basic sciences portion of the program. You're on the island for 5 semesters, and, there's different courses and, content that's divided over those 5 semesters. And you attend lecture, and you have tests. A couple classes have labs. The anatomy class that has cadaveric anatomy, which is really great. That's what you spend your time doing. But, sort of outside of that, there's a little bit more to it than just the in-class and studying portion. The island is a really great little community. I don't know the exact population number, but it's not large, even including the students. And, very quickly you get to know, of course, the other students, the faculty, and the people that live on the island, the people that run the grocery store, the people that will end up being your landlords, the people that you're going to see at different restaurants every day. It's a really nice little place to study and to be able to focus on, studying medicine and learning medicine. So the island was great. My friend, again, who had graduated ahead of me, said, cherish the time that you have when you're on the island, because once you leave there, you're going to miss it a lot. And I definitely do. It's a really great little place to live. So, okay, so that's enough about the island portion. Where I am now is in my clinical rotation. So as I mentioned, you kind of do the island portion, and that is about 5 semesters. In between, you have the study period for step 1, and you have to write a research paper. And then, you start your clinical rotations. That's broken up into 2. One is your core rotations, which is, sort of 3rd year, and then your elective rotations, which is usually 4th year. And I'm just coming to the tail end of my 3rd year. So I think that's enough about background. Again, if there's, questions about that kind of stuff, I'll try my best to answer them. Right. So the admissions committee had actually sent me some questions that they get from prospective students a lot. So I thought I would go through some of those as best I can. I got them, a couple days ago, and had a chance to look through and kind of jot some things down, to make sure that I really thought about, the information that I was giving, and that it was accurate. So I might refer just to my notes a little bit and to the list of questions here. So the first one, okay. So the first question that I got from the admissions committee was, what did Saba do to prepare you for your clinical rotations? That's a good question. So, the learning on the island is sort of broken down into 2 major categories, if you want to think about it that way. You have clinical knowledge and clinical skills. So when I say clinical knowledge, I kind of think about that as like the foundation of information that you need to be able to practice medicine, the theoretical knowledge, all the way from the basics of genetics and bacteriology, virology, anatomy, physiology, all those sorts of things. And then as you kind of work your way up, sort of what we call systems and disease classes that focuses on the different organ systems, common pathologies and that sort of thing that you encounter. So that's sort of in the clinical knowledge. That's helpful because, when you get to the hospital and you're discussing patients and, the illness they have and the treatments they're going to need, you want to be able to contribute meaningfully to that discussion. And I think the clinical knowledge portion that you get from Saba really helps you contribute to that discussion. You have a good understanding of, a patient with COPD, what it is exactly that's going wrong with their lung function and how to, sort of think about what the best way is to approach their care. So that's kind of the clinical knowledge portion. The clinical skills portion is also broken down into, I sort of think about it in two different categories. The first way that I would think about clinical skills is kind of the technical skills, so do you know how to auscultate the heart? Do you know how to auscultate the lungs? Can you palpate an abdomen properly? Can you examine a knee? These are kind of things that you need to learn while you're there. And Saba, does a really good job of teaching us that. We have, a marked proportion of our schedule is directed towards that part of clinical skills. And because the class sizes are so small, when you start doing those things, when you're, in your upper years, I think when I was there anyway, it was your second semester that you start kind of that a little bit more of that hands-on stuff. The faculty to student ratio is pretty good. I think, I'm trying to remember what it was. Well, anyway, I don't want to give false information, but all I can say is that there was a lot of faculty, for the amount of students we had. We were broken up into different rooms, and there were faculty in all the rooms, and we got to interact with them to really make sure we're doing those things properly. Because to just watch a video on how it's done and then do it, that may not be as helpful as the way it was done there, which is kind of hands-on, direct feedback on how we're doing things. So that's one part of the clinical skill. The other part of the clinical skills that we learned was more intangible, about how patients are experiencing their illness and how you're going to interact with them, so not just what you say when you talk to a patient, but how you say the things you say when you talk to a patient, what they're feeling, what they're thinking, what their perspective on the illness is. These are all things that you kind of have to learn to take into account when you're, caring for a patient. And that's sort of the intangible part of clinical skills that we also covered, in pretty good detail on the island. So again, the question was, what did Saba do to prepare you for your clinical rotations? And that was clinical knowledge, a thorough background in the pathology of disease and the basics of, human physiology and that sort of thing. And then clinical skills, both technical and sort of intangibles for interacting with patients. So hopefully that sort of answers the question on how Saba prepares you in that regard. The next question, let's see here. How has Saba worked with you to line up your rotations to help you achieve your career goals? Okay, so right now Ryan is in the core rotations, and that's in your third year. So when you do your third year of medicine, you have to do a rotation in internal medicine, surgery, pediatrics, OBGYN, and psychiatry. So those are the sort of 5 core rotations. And the clinical department sets up that schedule with you, but they set it up for you. But the best part is that they don't set that up sort of absent of your input. So before your clinical schedule is made, you complete, a form, and it basically, the idea is to give your input as to what you're interested in for your career, whether it's surgery, whether it's internal medicine, whether it's psychiatry, and what your practical preferences are about how, where you want to be in the country maybe, or if you want to move, if you what kind of hospitals you want to be at, that sort of thing. All this sort of input gets put together in this process when you're working with the clinical department, and they try their best to incorporate that into your schedule. For me, it so happens that they were able to incorporate all my preferences actually into my course schedule. I asked to, see a lot of different hospitals and a lot of different hospitals in different communities, so that I could, be well versed in the different types of patients you might encounter throughout the U.S. So they were really helpful in that. So that was good. Hopefully that answers that question. Let's see. The next question was, okay, what is a typical day like during clinicals? Okay. So I would say that varies depending, it varies depending on which type of rotation you're doing. So as I mentioned, so far in order, I've done my psychiatry rotation, my pediatrics rotation, internal medicine, and surgery. Those are the 4 that I've completed so far. I still have to do an OB/GYN rotation which actually starts next week. So let's say for internal medicine, a typical day. You arrive at the hospital at a given time. It varies based on the site. When you get to the hospital, you usually meet with the intern, which is the first year resident, and they'll usually assign you a patient, 2 patients, 4 patients. It depends on how things look for that team. Once you get assigned a patient or patients, your job is to learn their story. So usually you go on the electronic medical record and you read about why they were admitted, what their care plan is so far, what other illnesses they might have, and sort of build your understanding of why this patient's here and what they're going to need in terms of care. And then you go see the patient. Oftentimes, actually, it's the medical student, besides the nurses who are on site all the time and, see them overnight as well. Usually the medical student is the first person to see the patient in the morning. So you go visit them and you ask them kind of an interval history. You ask them how their night was, and you sort of ask some directed questions based on why they're in the hospital. And then you do a quick exam. So for as an internal medicine example, if a patient's admitted for a COPD exacerbation, you might ask them how they were breathing overnight, if they needed treatment, if they've had a cough, these kinds of things. And then you would, do a lung and heart exam. Once you had all that information, that is the story that you learned from the chart and the information you got from interviewing the patient and examining them, you would have that ready for when you did rounds with the attending physician and the residents. And it would be your job to kind of present the patient. And earlier on in the rotation for internal medicine, usually you're sort of, I guess the term is used as a reporter. So that is, you're delivering information and the team takes that information and they sort of help formulate a plan. But as you progress through the rotation and become more familiar with different things, the idea is that you can start to contribute to the plan for that patient. Are they going to need any particular diagnostic testing that day? Are they almost ready for discharge? Are they going to need a change in their antibiotics? These are all things that, you're going to be involved in, once you build that experience and knowledge during the clinical rotation. So that's for internal medicine. Surgery, I'm only talking about these 2 because they're a little bit different. It's actually quite similar in the morning. You still arrive at the hospital early. You get assigned patients by some mechanism. You go see them. After you learn their story, you do an exam, and you're going to present them on rounds. And again, discuss their plan for the day and what's sort of next. But another good aspect is that you get to be in the operating room. So a lot of patients, come to the hospital and they're admitted to the surgery service. But there's also patients that maybe came in overnight that need surgery, or there's patients that are in what we call day surgery that are in for an elective procedure, and usually the students get to participate in that. During my surgery rotation, I was in the operating room every day except Wednesdays, which was sort of the academic day at the hospital that I was at. And even then, sometimes in the afternoon or in the evening, if you were on call, something would come up and you'd get to go to the operating room. So that's sort of the two rotations that you spend a lot of time on. Those are both 12 weeks rotations. So that's kind of what a day in the life of a medical student looks like on those rotations. Pediatrics is very similar to internal medicine in that, the patients are similar and they're just younger. The diseases are a little bit different, of course, because they're pediatric patients. And psychiatry, at the hospital I was at, we spent a lot of time with the attending physician. Again, you're sort of interviewing patients, meeting patients, learning their story, and talking to them. So that was what I've done so far. Let's see. Next question was, what is the most interesting or exciting moment during your clinical rotations? Okay, so the one that jumps out at me the most actually is one that took place on my most recent rotation, which was my surgery rotation. It was about, I think it was about 10 p.m. and I was, where was I? I was in the call room with the intern, and we were, just discussing the tasks we had done, the things we needed to do, and we got a call from the attending physician in the emergency room for a surgery consult, and we got down to the emergency room. We met the patient, and we did a brief history, physical exam, and it was like a textbook case of an incarcerated hernia. She was quite ill, and her abdomen was acute. It was probably the best way to put it for now. And we ended up placing an NG tube, and a large amount of material came back. And within, I think, less than 2 hours, maybe less than an hour even, the attending physician that was going to be caring for that patient showed up, and we went right to the OR that evening. And did a sort of exploratory laparoscopy, found the hernia, pulled the sac. Sure enough, there was incarcerated bowel there. So it was, we did a segmental resection of the bowel, put everything back together, closed her up, and, she went to the floor. So it just, maybe what I'm trying to explain is a bit intangible, but to me, it was just a very, kind of exciting but also rewarding experience to have somebody come in with a problem that needed fixing right away. And there was this attending physician who had all the tools, and he knew exactly what to do, and he fixed the problem. It was just really exciting. Couple other ones that stood out. I think the first time I did a central line, that was really exciting, and the first time that I was on a code where we got return of spontaneous circulation, that was also really exciting. So I think that, hopefully that answers that question. Let's see. Next question. So which rotation did I learn the most, or which rotation did I like the most? Those are sort of two different questions, but let me talk about so I can't really say which rotation I like the most. I would have to say probably it was surgery, but there's good things about all the rotations, honestly. Which one did I learn the most, or what was the biggest takeaway? As I mentioned, I've done psychiatry, peds, internal medicine, and surgery. The two I think that I learned the most on were actually both internal medicine and surgery, and they were different things. For internal medicine, it's a lot of sort of foundational knowledge. The stuff that you study when you're preparing for your step one is very relevant to internal medicine. You have time on that rotation to really delve into and consider the underlying pathology of disease, and how you approach the treatment for each of the patient's systems. And I would say it's less hands-on than surgery. So it's more kind of sort of theoretical and cerebral, and you're kind of using like this all the information you have in your sort of theoretical armamentarium, to come up with a treatment plan and that sort of thing. Surgery is a little bit different in that you actually don't, if I had to be honest, you actually don't really learn a whole lot of detail when it comes to surgery at the MS1 and MS2 level. When you're doing your basic sciences, you'll learn something like, if a patient comes in with right upper quadrant pain and you do an ultrasound and it's positive, then you'll take out their gallbladder, okay? But what you actually learn on the surgery rotation is what take out the gallbladder looks like. And that is in itself really exciting. There's a lot that goes into it. You have to think about how you care for, prepare the patient before the surgery, what sort of risks you need to assess for that patient. Then you have the actual surgery, where, you need to actually do the procedure, take out the target organ, in this case, in this example, the gallbladder, and also be prepared for if something goes wrong. And then you need to care for that patient after the surgery. Sometimes they go home, but other times they go to the floor, and you're kind of responsible for thinking about what do you do if the nurse calls you at 2 a.m. after the day of a surgery and says, this patient's having this problem. So my eyes up, to what is really involved in surgery, and it's more than just more than just really kind of cutting, let's say. So it was good. It was both of those I learned a lot. Internal medicine, I learned a lot because you really have to understand, physiology and the mechanisms of disease, and then you actually have to carry that information, to a surgery rotation where you learn hands-on skills to go along with, that sort of basic knowledge. It's the whole third year has a lot of learning in it. So. Hopefully that answers that question. And I hope this is helpful. I hope I'm not rambling too much. I just want to answer these questions, with as much, clear detail as possible. Okay, next question. Did you move around for your core rotations? Yes, I did. And I requested that. I asked, when I think I mentioned a little bit earlier that I was, when you're working with the clinical department for your schedule, you kind of have some input into how your schedule is set up. And so one of the things I asked for was to be at some different sites during my third year. And the reason I wanted to do that, okay, so go with me here on this. It's a little bit of an explanation, but I think it's important. When you arrive at the hospital, as I described, either, on any one of your rotations and you get assigned a patient, you have to kind of learn their story and be able to sort of consolidate that knowledge all very quickly and be able to make meaningful contributions to the treatment team. And that in itself maybe is almost like a microcosm for the skills you would use to go to a different hospital and, sort of learn the process and be able to integrate into that team. So, you spend 12 weeks at a hospital for your internal medicine rotation. You meet the people that work there. You learn about the electronic medical record system. You learn about how rounds are done. You learn how to present a patient, and you sort of learn the process at that hospital. And by the end of your 12 weeks, you're much better than on day one, because you've had experience sort of getting used to and integrating into that environment. And then you go to a different hospital maybe for your next rotation, and you have to do it all over again. And, you have to learn new team members, possibly a new EMR, new steps for doing rounds and all these sorts of things. And so that skill of being able to go from one environment to another and adapt quickly, I think is very important when you're practicing medicine, because that is, how you handle your patients. You meet them and you learn them very quickly, and you have to be able to make meaningful contributions to their health. So so I did move around during my rotations, and that's why I wanted to do it. I thought it was useful. Well, hopefully that answers that question. Okay, next question. Let's see here. Sorry, I'm just turning the heat up a little bit. I'm in Canada and I'm outside in a screen-in porch, so it's a little chilly. Okay, how did the clinical team work with you during your clinical rotations? Okay. Um, so there's kind of three ways. And I'm only at the, let's say, one and a half of those three. Maybe two. So the first one is the core rotations. So as I mentioned, when you finish your time on the island, you're going to interact with the clinical department and come up and work with them to sort of produce a schedule for your third year. But then once you start your third year, you're not done interacting with the clinical team, because each week you have to complete assignments, patient logs and other related assignments, and you'll have a particular clinical dean that reviews those assignments and gives you feedback. And that, I think, is important for being able to sort of make sure you're developing those skills properly, because writing proper patient notes in a proper fashion is going to be important, not only when you're working, but also for things like, step 2 CS. That's an exam, the clinical skills exam that you have to do. They have ways to make sure that you're working properly towards that goal. So during core rotations, during your third year, you interact with the clinical department, partially when you're setting the schedule, and also kind of on a weekly basis by getting feedback for your assignments. Another way that you sort of interact with the clinical department is during fourth year when you're setting up your electives. They sort of serve as a hub for your elective rotation schedule. What you do is you produce for yourself an elective plan of what rotations you'd like to do, and then you deliver that plan to your clinical dean, and they advise you on a couple of things. One, does it meet requirements? Will it allow you to meet the requirements for graduation, which is important? And also, if they have any advice to give you on whether that elective plan fits well with your career goals. And I think that that input from them is very useful when you're trying to formulate how you want to generate your elective schedule. And then what's the third way? The third way is for the match. I'll be applying to the match for the 2020 match, which actually starts in the fall of this year. And there's another member of the clinical team that oversees that process and interacts with you to make sure that you're having everything prepared when you need to, in terms of your personal statement and your letters and all these sorts of things that are required for the match. So that's sort of how the clinical team works with you during your clinical rotations. And then, of course, if any other questions or problems arise, they're just an email away. You just send them an email and you can reach out to them. Let me see. I make sure I didn't have any more. I think that actually covers all the questions that I got from the admissions department. So I'm not sure, if there's anyone that's watching that has any questions, feel free to type. If they're questions that I can answer, I'll try my best. If they're not, I will direct you to the admissions department if they're not, if it's not something that I can answer. One thing I thought would be, kind of exciting to mention, and if you watch the Saba Facebook page, it was mentioned on there, but I just thought it was useful to mention that there was a team from Saba University that was myself and 3 other Saba students, Jenna and, oh my goodness, Konksha and Steve, 3 other Saba students, and we competed in a sort of medical knowledge competition at a conference of the American College of Physicians. And there were a number of schools there, different hospitals. There were St. George's students there, I believe, some from Johns Hopkins, U.S. military medical school. There was a number of teams present, and the Saba team actually came out on top. So that was kind of an exciting event. And to be honest, I'm not really a big fan of self-promotion. I'm actually mentioning it for one reason, and that is because I just want to make sure that it's clear that Saba prepares its students really well. The reason that we did that well and we were prepared is because, you know, I mean, those are the things that we learned. You know, a lot of it was based on basic sciences knowledge, which we got, you know, from the island. So I just wanted to kind of point that out. Great. Well, it actually doesn't look like there's any questions. So I think that's it. Again, if anyone has any questions about anything, probably the admissions department is the best group of people to ask. I know that they were certainly helpful when I was applying. So if you have any questions, reach out to them. And that's all. So I hope this was useful, and all the best of luck, whether you're thinking of coming to Saba, you're a current Saba student, you know, who knows. All the best. Okay.